but...
Alright, this is Mr. Wolf. I want to show you a few techniques for properly dissecting your pig. So first thing is make sure you have clean work area. Get your tray out there, ready to go. Any diagrams, whatever you're going to use, have those at the ready. And then get your tools. I like to take them all out and lay them out where I can get at them easily, what I'm going to use and what I'm going to need. So there we go. There's pig specimen. I've already rinsed them. Take them out of the bag. Set them on the dissecting tray. It's like to hit it with a little spray of BioShield. Beginning of the day to kind of keep the smell down a little bit. Helps. And so I just want to show you the day one things that you would be doing. So one, you're going to be examining just all the external features. These are the mammillary papillae there, the umbilical cord, the nares, that would be that, ears, different structures that you'd be looking at. Gestational age, you've got a tape measure here where you're going to measure from the tip of the snout to the posterior end. So this one's about 12.5 inches. So then you'd look that up on the chart to see how long this pig had been in the gestational period. Okay. Gender of the pig. So a couple things you're going to need to look at is, for the males, you would look and see if there's a small opening just posterior to the umbilical cord, and on this there isn't one. So I'm thinking, okay, this is not a male, but then I'm going to confirm that by looking at the rear end. If it's a female, there'll be a urogenital opening just ventral to the anus, so you can see right there the urogenital opening there. So this is a female. Wish I had a male to show you contrast, but I don't. But the male would have a small opening here posterior to the umbilical cord, and there would be no opening back here below the anus if it was a male. But you would see two sort of bulging structures in the back there, so you know it's a male. So those are about all the things on the first day, except for one of the things you are is going to try to look at the salivary glands and the masseter muscle, which is right here on the side of the face. So what you want to do is use the pointy end of the scissors, get in under there, under the skin. Try not to pierce too far under the skin, and just slowly cut away a circular area. Then what you usually have to do is sort of lift up on that and snip away at some of that connective tissue underneath the skin to expose the muscle and the salivary glands. And that came out nice. So there you go. So there you can see that big masseter muscle, and I don't see the, oh, here we go. So back here in this area is where you'll see the glands, the salivary glands, and some lymph nodes. So there you go. That's pretty much it for day one. Then I'd hit, when I get ready to put it away, I'd hit this again with a little BioShield, and then put it back in the bag. Clean up the area.